Hi guys, welcome to today's NCLEX question answering strategy, elimination techniques, and analyzing keywords. I can tell you for free if you stay true to the end of this video, you're going to gain a lot, right? So this approach help in narrowing down options and knowing the question focus, especially in questions where more than one option seems correct. Now use the elimination techniques. We have examples, right? Let's just talk about it a bit, right? The NCLEX often presents multiple correct sounding options, but only one is truly the best. We all know this. Now, this strategy requires you to carefully analyze each option, crossing off those that are clearly incorrect or less appropriate to the given scenario, context, and here's how you can implement it. One, you want to start by read the question and all the options fully. Don't jump into conclusion. Fully read each option as minor details may disqualify an answer, right? So next you want to identify and eliminate distractors. Every NCLEX question have distractor. The distractor can be three distractor, one correct answer, right? And sometimes the distractor can be one distractor, three correct answer. I don't know if I'm explaining something right, but let me tell you in what scenario. In case the question is telling you which of the following claim statements require further teaching, meaning there's three correct answer, but there's one wrong statement. Three right statement, one wrong statement. You understand? So if you understand what I'm trying to say, so look for answers that might sound correct but does not align with the core issue in the question. Distractor often include words that make an option too absolute, like always, never, right? Or focus on something secondary. I tell my students anytime you are tackling an NCLEX question, always focus on the primary issues except if the NCLEX asks you for the secondary, right? Next, you want to cross out obvious wrong choices. Sometimes two options are easier to rule out due to irrelevant or lack of priority. Once you are able to narrow it down to two options, focus on minor details that make one option superior. Now, our first example, we have a patient who underwent surgery and exhibiting sign of restlessness and increased respiratory rate. Which action should the nurse take first? Now, remember we are using elimination. So let's look at what we can really eliminate right here. You understand? The question is asking what would you take first? The question is not asking most important. Most important give you that idea that you might need to skip your assessment and then jump to intervention. You understand? Most important means you might not need to necessarily do anything, but straight go and report to the doctor, go and report to the physician. But right here, the question gave you the keyword take first, meaning they expect you to do something before you decide to even communicate with the physician, the doctor, or that. So easily we can take out A, true or false. Yeah, we can do that. Now we have B, check the patient oxygen saturation. One way you even know if it's aligning with the context of the question is ask yourself, is there anything that have to do with oxygen that can cause restlessness, increase respiratory rate? Ask yourself the question. And I know you are saying yes. If you are still thinking about it, join my course because you need to find that perfect understanding. You need to join my program to find that perfect understanding. Now, if you can understand that, yes, oxygen can cause restlessness, increase respiratory rate. So let's move on. We keep our B. Now, administer prescribed pain medication. If you're asking yourself, how will this cause that? Increase respiratory rate. When the patient have severe pain, it will definitely cause that. You understand? And the body will definitely require more need for oxygen and something. So it can really graduate to even restlessness on a long run, right? So B and C is something we can easily keep. D, provide patient education about post-operative care. It's just like right now, you are hungry, you want to eat, and I am telling you about a movie that I watched yesterday. How would you feel about that? You've not solved your situation that you are hungry, you want to eat, and I'm telling you about a movie I watched yesterday, and I want us to discuss about the movie. Would you be so interested in doing that? No. So why do you think a patient that is exhibiting restlessness, increased respiratory rate will be ready to get education about postoperative care? No. So you can easily take away A and D. You are left with B and C. So now the question that you are asking yourself is that which of the following will best address what the patient is having? Or which of the following is best at risk for restlessness, increased respiratory rate, or which attain the highest level of safety? Or can I really apply my ABC? Yes, every of what I listed will work. Let us say you are applying your ABC. ABC, airway, breathing. You can see respiratory rate is affected. Oxygen is something that can cause restlessness. So let's not even think too much. B is the correct answer right here. Guys, if you need to critically think, if you are someone that don't know how to critically think, trust me, you need to join my program, right? We are going to talk about it later, but you need to join my program so you can learn how to critically think, analyze questions, right? You can see we were able to eliminate A, D, right? And we're left with B and C. Anytime you are unable to eliminate, you have 25% chance of getting the answer correctly because you have four options, 25% first, second, third, fourth. That make 100%. Now, if you eliminate two options, you have 50% chance of getting the answer correctly. And when you link it back to the question, you have like your 100% chance of getting the correct answer, right? So let's move on. Pay attention to keyword. The NCLEX question may contain specific keyword that guide you towards the correct response. This keyword can signal priority, urgency, or type of action required. Common keyword to watch for include, let me tell you, this particular keyword you see right here is what I teach my students in the course. And because they are able to know this keyword, they know the best way to answer any question. They know when assessment is not priority, and they know when intervention is the one that is priority. They know when assessment is priority and whereby intervention will be done later on. Let me now tell you, if you see keyword first, initial, immediate, priority, they are trying to tell you that let us take the whole step from A to Z. Meaning, if it is assessment that we are starting with assessment down to evaluation. But if you see most important, most effective, best, this is telling you that let's choose intervention answer. So even if you have a question, if you have a question and they tell you best, most effective, and assessment is there, assessment is not the answer because they're telling you the best. Meaning they're trying to tell you, let's not waste time in doing intervention. Intervention is not, I'm sorry, let's not waste time in doing assessment. Assessment is not what we need now. We need to act fast. It's just like a patient with stroke showing sign of let us say they started developing slow speech. This is not the time to start assessing neurological or doing neurological assessment. This is the time to intervene. Call the doctor. You understand? You get what I'm trying to tell you? Best, most effective, most important. You are jumping assessment going to intervention. Now, further teaching needed. We know this already. Further teaching needed. We know this, right? Further teaching is just that all options are correct except one statement the patient said that is wrong, and we need to teach the patient again. Understanding means that every other options are correct, but one option that the patient said is sorry, every other option the patient said are incorrect, but one option is correct. You understand? You're looking for a statement that the patient will say that is the best understanding. You understand? Contra indication means we are pointing to an action that should be avoided. So, next example, we have a nurse that is teaching a patient with diabetes about food care. Which statement by the patient would require need for further teaching would indicate need for further teaching. Now, need for further teaching, our knowledge is that we have three options that is going to be a correct statement, but one option will be a wrong statement. So what do I tell my student? I tell my student, what is the problem in the question? Diabetic foot care. Now, read option A. I should inspect my feet daily for cut or blister. Ask yourself, inspecting feet for cut and blister will it help with foot care with diabetic patients? Yes, correct. I will wear well-fitting shoe to protect my feet. Would that help protecting the feet? Yes, correct. I should use a heating pad to keep my feet warm. Is that going to help? No, because take for instance, the patient cannot feel anything. What will happen? They burn their feet and there's injury. You know, with diabetes, injury is hard to heal. So C is going to be wrong. But let's not really say C, let's still read option D. We need to be sure, you understand, because we still have one option. I will trim my toenail straight across. Do we want to do that? Yes, we want to do that. So we can finally say C is the correct answer. So C is the correct answer, not that it's something we want diabetic foot care patient to do, but they need further teaching with that. Is that clear? Correct. So now, number three, be wary of extreme language. Watch out for words like always, never, only, must, every. In a clinical context, absolute are rare. So options that include this word are often incorrect. I tell a lot of students when I give them question, they will say, "Oh, I chose an option that has never and I got it wrong." There are some answers that never is correct for them. You never give potassium IV push. So if you want to know those options that never is very correct for them, you need to join my course because I have everything under my course. You will learn them. So you will know which statements are 100% never. You understand? But most of the time, never are wrong. Only are wrong. Most, every, that is absolute. They are definitely wrong. But in some cases, the ones that align with NCLEX guideline, never give potassium IV. You understand? There's a way I explain this to students that they really understand the concept. If you join my program, you are definitely going to get that concept. Here is just to talk about the strategy, right? So now we have our question right here. A nurse is teaching a new model about breastfeeding techniques. Which statement indicates correct understanding? At this point, a lot of students are thinking, oh, do I remember the correct techniques for breastfeeding? Not knowing the NCLEX has put absolute for you to just get this question easily. And you have students start to be thinking, I must always wake my baby every 2 hours for feeding. Is that correct? Is that correct? Is that correct? And they think about it for hours. Whereas I must make it wrong. You understand? And they will think about the option. They will say they don't know the answer. Whereas Absolute has made this option easy for you to get it correctly. I should avoid switching. No. You understand? I can hold my baby in different positions as well. That is correct. No absolute included into it. Right? I must feed my baby on a strict diet. Even the word, you can see it. You can easily tell. So C is the correct answer. If you know how to use absolute, trust me, most of the time, what I do when I see any question is to see if there's any absolute because I want to really take that out. Except if those absolute are part of the NCLEX guideline that require never. You understand? So, yeah. Now, four, avoid reading too deeply into the question. A lot of nursing students do this. And remember what I said, when you read too deeply, you tend to um get the answer wrong because you have mixture of different things you think is the answer. So don't really read deeply into question, right? Because I know this as I'm saying, I'm an NCLEX coach. I've coached a lot of students, and I can tell you sometimes students fall into this trap of overthinking and assuming extra information that is not provided. So I want you to stick to the information given in the question and avoid making assumption. So let's use this question to practice the fact that you are not thinking about any information. The only information we have here, right, is that we have a patient who is experiencing dizziness after standing up quickly. Which initial action should the nurse take? So that's what we have. Patient is dizzy because they are standing up quickly. So what should we do? Right? Now, I told you in my previous video, anytime you see assessment, right, there's chances that that question is requiring you to do assessment. So you need to look at that assessment. Does it align with what is happening? It aligns because only a patient being dizzy after standing up too quickly, I cannot really picture out what is going on until I perform assessment. Even if nursing knowledge has given us the knowledge that it means maybe the patient is going through auto orthostatic hypotension, something like that. But remember, we said only stick to the information. Don't assume extra information. Let's leave what is just here. Our because of we have this few information, I will be prompt to want to do assessment, right? I'll be prompt to want to do assessment. You understand? Okay, just like right now, I tell you, I want to send you to go to a particular location. I just told you only the location. If you don't know the location, what would you do? Would you start to be thinking about it and say, okay, I will figure out how I can get to the location, I will this, I will that. You might misplace yourself, you might get lost. You understand? But if you ask me, how do I get there? Me that I'm sending you to the place, know the best way you can get there. You understand? So if I do assessment, it will be the best information I will get about what is going on with the patient. You understand? So this way, I did not read too deeply and I was able to identify I need to start with assessment. You understand? So B is obviously the answer, guys. Now, number 5, avoid choosing option just because it sounds technical, right? A lot of students as well do this, and a lot of students that get affected with this are students that maybe they bought a particular program and the program is full of difficult questions. Most program you buy to answer question only put questions that are difficult because they believe when you can answer difficult question, when you see those easy questions on the NCLEX exam, you will find it less challenging. But the truth is that because you practice more difficult question, you are now technical. When you see a very easy question, you feel those easy answer are easy to be correct, are true to be correct. So you don't want to choose them. So it's not a problem. You understand? For critical thinking to work, you need to understand the principle, the concept behind that particular question. If you don't understand that, you will never believe in any answer. You will think the most complicated answer is the correct answer. So look at this example. A patient with heart failure is complaining of swollen leg. Which action should the nurse prioritize? Right? Which action should the nurse prioritize? Now, swollen leg is what we want to solve. Yes, administering directives can solve the problem. Monitoring daily weight. The reason why I will not select monitoring daily weight is because if I monitor daily weight, right, will it solve that swollen leg now? No. So me personally, I'm going to take out B. You might include it as part of your option because when you solve the swollen leg, um, as part of routine, monitoring daily weight is something we need to do because this patient is having heart failure. Now, educating the patient on reducing sodium intake as well to can limit fluid because based on heart failure, we are thinking there's too much fluid that is causing the swollen leg, right? Elevating the leg as well to can help us reduce uh the swollen leg. You understand? It's just like maybe there's the blood is not really returning, then it's releasing the fluid content of the blood to the peripheral surface, causing the swollenness, right? So in order to help us out, if we elevate, there's more blood that will return, less swollen leg. You understand? So now they are asking you which action should you not prioritize. I can easily remove B and remove C because I want to do education later on. Education will not solve anything now. If I educate the patient about sodium intake, it does not solve the current fluid that is built up in the leg, right? The two options I can do right now is administer directives and it start working, elevating the leg, and I start helping out with the swollen leg. So now, priority, I said more think about least invasive. You understand? In this context, we have D as the least invasive. Invasive. This is how NCLEX wants you to think. So D is the correct answer right here. Okay. So if you are someone that you need help with your NCLEX study, join my course program. It's going to help you out in how you can critically think, answer NCLEX question, right? All these questions we have been answering, we are not answering it because only strategy made us to answer it. We are answering it because we've been able to master a lot of content the NCLEX decide to test on the exam, right? We have over 330 something content the NCLEX is testing on the exam, right? I am so sure you are not going to get tested on all the 300 content. You might be tested on few, but the thing is that you don't know what question will be generated for you, right? So it's best you know audio 330 something, so you are covered with everything the NCLEX is going to test on the exam. So once you get the you get your 150 question, because the truth is that 150 question is going to be generated for you when you want to take the exam, but you are expected to pass in 85 questions, right? So if you are unable to pass in his 5 questions, you get the remaining question to get to 150, right? So with that being said, we train you on the 330 something content, right? So once you are covered on everything, then you go on the exam, you use our strategy. Trust me, you are good to go. You will find it. You are going to really think you are doing another practice test, and then you easily pass the NCLEX exam. So if you need help with your NCLEX study, DM me on Instagram at futurern_pn. Just type futurern_pn. You are going to see me on the black logo. Then send me a DM and let's get you on the right path to pass the NCLEX exam. I'll see you in my next video. Bye.